Welcome to the CR Arthritis 2025 event. My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Today, I'm joined by Dr. Gerschman, who is a pediatric rheumatologist in North Vancouver, British Columbia. He's also a clinical instructor in the Division of General Pediatrics at the University of British Columbia. And in his practice, he specializes in pediatric rheumatology, sport, and exercise medicine. Thank you so much for joining us today, Dr. Gerschman.
Well, thank you very much for having me.
So, Dr. Gerschman, I know you'll be presenting at the CRA conference on the topic of AI scribing, and we'll get into that, everyone. But before we get there, can you share a little bit more about yourself, how you're involved in rheumatology, and maybe how sports and exercise medicine also came into the picture?
Sure, thank you. Yeah, I've sort of lived a little bit in both worlds. For about 8 years or so, I worked actually in Calgary at Alberta Children's Hospital, doing pediatric rheumatology in the with the team there. And I've also done a bit of work in Winnipeg and in Edmonton, and also several times also over in Vancouver at BC Children's Hospital. But for about the past dozen years or so, I've primarily been working in the community as both a pediatric rheumatology or pediatric rheumatologist, but also as a pediatric sports medicine doctor. Um, Both, of course, have an overlap in terms of the musculoskeletal element of things. And one of the things that I found really fascinating was working with children who had things like juvenile idiopathic arthritis, who were also athletes, and trying to find ways to support them to meet their goals and aspirations and really be able to support them, which was a real pleasure to do and a good marriage of those two specialties. I've also been working very closely with the Canadian Rheumatology Association for the last several number of years, connecting those of us in the community doing pediatric rheumatology, and more recently been working on the board at the CRA as well.
Oh, it's incredible work. And like you said, like such a um interesting like intersection where your work is at, but so important, right? Not only is sport or physical activity or exercise or movement important for our health, but it's also part of like, so it's just I always like to say it's like it's part of development, it's part of childhood, right? Sport is not just good for our health, but it's also key to our development.
Yeah, and I mean we do see that children with juvenile arthritis tend to be on average less active than their peers that don't have arthritis. So even more important to try to keep them active because we do have this epidemic of inactivity that affects all of us. So I think keeping kids who are active and enjoy being active, keeping them active with or without a diagnosis, and then when they run into problems, finding ways to support them and keep them moving is something that I really enjoy doing. And also seeing some of these kids who have chronic disease like juvenile arthritis also be able to achieve the highest levels of success in various types of elite levels of sport, be it professional sports or, elite high level competitions and things like that.
Yeah, absolutely. Like a diagnosis of juvenile idiopathic arthritis doesn't mean that these children can't go on to achieve, like you said, the highest levels or merits of sports. So,
Yeah, and I think that's one of the most amazing things in the last 20 years or so of treatments that we have is that when I see a patient and give them a new diagnosis, that's exactly what I say is, and I don't think I think it would have been a lot more challenging for us to be able to say that before 20 years ago or so. But today, that's something that we can work towards and hopefully achieve.
absolutely. I'm so excited for like the medical advancements, and we'll get more into that in a little bit. But I would like to ask now about artificial intelligence or AI scribing. Could you tell us a little bit more about what is artificial intelligence or AI scribing?
Sure. I think that term artificial intelligence definitely is a broad one that gets applied to a lot of different things. I think that people maybe have become increasingly familiar with ChatGPT, which is based on something called the large language model, which is essentially a prediction engine. It sort of predicts what the most likely thing that one would say or what the answer would be to a particular question. And we're seeing more and more applications of using AI, including large language model tools, in medicine. And one of the reasons why this is really interesting and exciting is that one of the things that is probably the most draining on physicians and rheumatologists is all of the charting, clinical documentation, and administrative work that we have to do to support our practices and make sure that we're capturing our encounters with patients and so on. And I think that's sort of the least fun part of the day in general. And these tools provide a potential solution for that. And so what AI scribes are they are specifically made for healthcare settings with appropriate privacy considerations and security considerations. But they're there to basically listen to the conversation and the encounter. And instead of me spending hours at the end of the day capturing those discussions and notes, the AI kind of supports that and is able to get down a first draft of what that documentation might look like. And then I can go in there and verify that it's indeed correct, make changes and edits that might be needed, and then be able to save it to the chart as I would otherwise. And so it really has that potential to reduce the amount of time that I would otherwise spend capturing some of that documentation.
Yeah. Like you said, AI, broad field, and specifically we're talking about the use of a large language model, like you said, a prediction tool to alleviate some of, like you said, this burden of charting. And I really think this is such an important topic because it's not just in medicine, it's also in my case, physiotherapy as well, right? Well, you could argue that's medicine.
Yeah.
It, there's so many allied health professionals that have to chart to keep notes. So if you've ever been in a hospital setting, like I am in myself right now, you are like, why are the nurses outside the rooms? Why are they on their computers all the time? It's like, no, they are constantly charting, putting in orders, ensuring that the orders have been filled and everything is very precisely documented. And using these tools, would you say that hopefully, in this case, Dr. Gerschman, it would allow you to then see more patients if some of this work is taken off your plate?
Yeah, absolutely. I think that the technology, first of all, it is advancing fairly quickly. It's very usable right now, and certainly I've been using these tools in much of my practice, probably for the last year and a half coming up to now, and it is continuing to improve and advance. There's still a lot of work that needs to be done because you still have to verify that it's correct and make changes as needed and so on. But I think you're absolutely right. What I've noticed is that I think one of the most positive experiences from it is that I get to have that interaction with the patient more. I don't need to be sitting there taking notes or typing things as we're having that conversation. I can focus on the patient and the face-to-face interaction, which is actually quite liberating and I think also very much appreciated by the patient. If I can save additional time and see extra patients on top of that, even better. I don't know if I in for specialists and certainly for rheumatologists, I don't know if we're quite there yet. Certainly for family doctors, they do talk a lot about that. Sometimes their notes are a little bit the way that they're structured is maybe a little bit more straightforward than some of our notes are. But the experience though, and the amount of energy that it takes to have to think about what you're documenting and is a lot improved by using these AI scribe tools. And I think that it's like other administrative tools that we have. We use computers to capture different information, and in labs come automatically into our system now and things. So this is another tool that's meant to help facilitate that engagement. The AI itself is not making any decisions or sort of substituting the doctor's assessment or plan. Instead, it's just capturing the conversation that we're having. And if I tell a patient, I think you've got a flare of arthritis in these three joints, and we need to start this new medication, that's what the AI scribe's capturing. It's not coming up with that plan on its own, or at least it shouldn't be.
Absolutely. And I've heard the word oversight. There will always be physician or specialist oversight with these tools. And like you said, everything is checked, everything is read over. But in the moment, and myself going through this right now, if you see 8 patients in a row and don't have a break, your memory, like I currently do not have capacity to remember exactly what I said in the first conversation I had at 8 a.m. And I really do wish I, was had more time to take notes. But then I'm in a place where like I'm not looking at the patient because I'm there with my notebook. So I can really see the value in this.
Yeah, and I think, I mean, sometimes it has a lot of unintended positive consequences. I like I said, that sort of face-to-face time, not having a notebook that you're scribbling in or whatever is certainly one of them. Depending on how you like to structure your day, I mean, some people are running late because some physicians are running late because they're busy trying to capture all those notes before that next patient. Because it tends to be that at the end of the day, you're more tired, there's more nuances to try to remember. And so usually it takes you 2, 3 times as long to sort of complete a note at the end of the day compared to if you're doing it at the time. Um, I think with the AI scribes, it's a little more reassuring that if I do leave it to the end of the day, I've got that basis there, and it's a lot easier. I'm not staring at a blank screen or my scribbles. I've got something to work off of, and it's a lot easier to come back to. So sometimes if I'm running really late, I'm not as worried about completing all my notes right there on time, putting me more late. So in fact, I'm able to stay a little bit more on time. It means maybe I'm doing some of that charting work after patients, but at least it's easier to do than it would otherwise be.
Yeah, I like you said, we are so new to this, all of us, patients, clinicians, scientists. We are just learning about, like, as you said, the unintended consequences. And yes, we are navigating the pitfalls of any new technology and trying to implement it. So yeah, very exciting.
I think some of the things too that people don't even realize, I can ask these AI tools to create summaries for me to give as a handout to patients. So if we've talked about a lot of complex things and different types of medications and their types of side effects and things like that, I can have the AI scribe generate a summary letter that I can then print out and give directly to the patient to take home and think about those things. And in fact, some of those AI scribes will also do different translations. So recently, I've had some patients, refugee patients from Ukraine, for example, and language has often been a challenge. And so at the end of our visit, I'm able to take that patient summary and ask it to be translated. And I can give that handout to the patients and check with them that it sort of makes sense in the context of everything that we've talked about, and usually it's been a very well received addition, and something that it would have been just unfathomable, even a year ago, but really helps with overall patient experience and patient care.
Yeah, I, I, especially like living in British Columbia, being a very large hub, like there's so many diverse cultures, diverse ethnicities that something like that is such a game changer. The application is very, very novel, and yeah, I cannot wait to learn more from you, Dr. Gerschman, and at your presentation.
Yeah, we're looking forward to our workshop that we're doing. I think that as exciting and as shiny as these things look, as with most things, it's how much time and energy you put into it often will dictate the quality and ease at which you get something out of it. And I think collectively, the Canadian Rheumatology Association, CRA, is really looking at helping to ensure that we have supports for rheumatologists, that we can support each other and being able to use this really exciting new tool in an effective way. And I think by leaning on each other, we can share some of those best practices and really optimize the usage pattern of these tools so that rheumatologists sort of stay one step ahead in terms of that technological innovation.
Yeah, that sounds like you guys have a very well thought out plan. Thank you for the sharing with us. Now, a little bit of a personal question. This year's meeting theme is, I will use my best spokesman voice, ascending to new heights, peaks of innovation in rheumatology. And it celebrates the latest advancements and breakthroughs. Can I ask, what are you personally looking forward to in terms of presentations, in terms of workshops at the CRA conference this year?
Yeah, I mean, I think that we have our workshop on AI, and I'm really excited to share what I've learned. But I know that whenever I get in a room of colleagues, there's usually someone else who's also jumped ahead and excited and doing different things, and there's certainly going to be things that I can learn from others too. I know that there's a few other keynote talks on artificial intelligence and its utilization in different ways, and so I'm looking forward to learning more about that. I think that, as always, the CRA is a great place to connect with colleagues and see what's happening in terms of other innovations and models of care that are being done across Canada as well. And it's always something that you can walk away and learn with and try to apply back at home as well.
And in your opinion, what is the keys for success when we put these advancements, especially these technological advancements in practice? I know you had touched on cross collaboration. I know you had touched on this iteration, right, and sharing information, but anything else we should keep in mind?
Yeah, I mean, I do think that we all do get excited about shiny new things. And that's great. And I certainly encourage people to be innovative and try new things and try to do things differently. But I think we have to temper that with, what is the bigger picture and is it actually saving me time or improving quality of care or improving the sort of the patient experience or the physician experience and so on. Because sometimes these technological advances on the surface seem like a good idea but actually end up just adding to the burdens of the work we do. And certainly there's studies going back the last couple of decades that show that with the move towards computers, we've seen that it takes people more time to do the administrative tasks. It takes away from time, face-to-face time with the patient, just like you gave in your nursing example, out of that room and working with these systems rather than good old-fashioned scribble something on a piece of paper. So there's always going to be this counterbalance, and I think that as excited as we can get with new tools, we have to look at the bigger picture and make sure that we're not just getting excited about the hype, but that it is actually making a meaningful difference. And also understanding the supports that often need to go into place to help support people not only be oriented and onboarded to using new tools, but also being able to maintain their use of it and checking in from time to time to make sure that there are ways that we can try to optimize how they're using it and so on.
Yes, absolutely. I always think of I got to be optimistic because I am optimistic about AI, but we as clinicians, scientists, patients are diligent about how we use these tools and asking ourselves, as you said, are they really improving patient care? So, such strong messages, and I hope the audience really enjoyed that session because I had learned a lot. Dr. Gerschman, thank you so much for sharing your afternoon with us, and we wish you safe travels to the conference.
My pleasure.
And with that, hope everyone has a wonderful rest of their week, and remember to tune in for the next episode of CR Arthritis 2025. Thank you. Goodbye.